Iowa doctors say it's only a matter of time before patients show up battling COVID-19 and the flu. KCCI's Kayla James is here with a look at the concerns of what they call a double whammy. Kayla?
Yeah, Stacey, and one of the main concerns is that more patients could start coming into Iowa's already full hospitals. Now, see this paperclip right here? It represents one of the more than 400 people hospitalized with COVID at this time last year. We're now more than double that number. Doctors we spoke of today say hospitalizations could increase if the flu is involved. This is the reality healthcare providers across the world face. Goggles fastened tightly, masks on, as they hold the hands of patients battling COVID when their loved ones cannot. But now an uptick in hospitalizations is occurring, and this year the flu is adding into those numbers.
We start seeing more influenza on top of COVID-19 or combination, it's going to be quite disastrous.
Flurona isn't a variant of the coronavirus. It's what healthcare providers call a co-infection.
It's not anything new for us. The difference, though, is the magnitude of co-infections and the severity of co-infections.
Dr. Megan Shrinovis says separately, the flu and COVID already infect the upper respiratory system.
And then when they're both causing damage on your system together, that could wreak far more havoc than if you had just one virus alone.
What's different from last year's flu season to now, Dr. Shrinovis says, is that people were indoors more due to COVID, wearing masks, and the flu virus may not have been as transmissible or severe as it is this year.
Symptoms alone are very difficult to distinguish between these because a lot of the symptoms are the same between flu and COVID-19.
Mercy One's Dr. Jeff Brock says the only way to know if someone has the flu is to be tested. But if someone is diagnosed for COVID and thinks they have the flu, Dr. Brock says they really should reconsider rushing straight to their physician for the test.
Doctors' offices and emergency rooms are just overwhelmed at this point. And if you already have one diagnosis and you're doing okay, might be best to stay home.